Guys, let us start off with the first part of this skeletal pathology. First, let us look at the normal structure of bone. Okay, there are two types of bone: compact bone or cortical bone. This is how it looks with all the haversian system, etc. And then you have the trabecular or cancellous bone. Okay, so this is 80% of the time it will be this only, compact bone only it will be. Okay. Look at this diagram. The outer part is the compact bone, and inside whatever bone marrow is there, that is going to be the cancellous or the spongy bone. It's also called as what? Spongy bone. They didn't put the word here. We'll just put the word here. So you have compact and spongy. Spongy is nothing but trabecular. Fine, guys. So compact is also called as cortical. It will be 80% of the time it will be this only bone. Next, moving on. First of all, what is bone? Bone is a specialized connective tissue, correct? What is bone, guys? It is specialized connective tissue. Fine. And there is another word for spongy bone. It's called cancellous bone. Okay. Now, do you know the parts of bone? Let's show you the parts of bone. See, bone, no. Here you have epiphysis, then metaphysis, high blood supply will be there, and then you have the diaphysis here. It's the shaft of the growing bone. Metaphysis, then epiphyseal plate, and then you have epiphysis. Okay. Then let us look at the blood supply. So you have the epiphyseal arteries, metaphyseal arteries, which are the hairpin bends actually, which are coming out of the nutrient artery itself. Okay. Nutrient artery enters via the nutrient foramen. Okay, guys. Then you have the periosteal arteries. So this should tell you the parts of the bone also, correct? So you have the periosteum. Then you have the, in the middle you have the medullary cavity. Okay. Good. Let's move on now. 3 types of cells you should know, guys. Something like osteocytes. These are normal sites of the bone. Then you have osteoblasts, which become osteocytes. Right? They are the immature. Then you have the osteoclast. These are the phagocytic cells. Okay. So apart from this, you have matrix, which has collagen, polysaccharides, hyaluronic acid, calcium, etc. When it comes to the compact bone, you can know that they have osteons or the haversian system. So they have the they are running parallel to the long axis of the bone. They are called as haversian canal. Okay, the center is called the haversian canal. You can see here. This thing is called as the osteon or the haversian system. And these haversian systems are transversely connected by volkmann's canals. Okay. All that you should know, guys. This is the structure, correct? Haversian canal, volkmann canal, etc. Okay. So haversian will be like, let's say, long. Volkmann will be transverse. Okay. It will be perpendicular to that. Look at this. You can see the haversian canals here and volkmann's canal joining it perpendicularly. Okay. Now one more diagram available here. Cross section. Look at this. You have the periosteum outermost, then Sharpey fibers, compact bone, endosteum, and medullary cavity filled with red bone marrow in children. In adults, it becomes yellow. Okay. So only the shaft of this long bone will have periosteum. Okay. Is this clear? So we have covered the normal structure of the bone. Coming to cartilage, guys, they will have chondrocytes and cartilage matrix. Okay. So I think we can move on to the pathology in the next video. See you. Bye bye.